Sure. Thanks, Jennifer. Hi, everyone. I'm Crystal Shen. I'm one of our legislative committee co-chairs, and I have the honor of co-chairing with Dr. Marcus Baca. We are so excited for upcoming Advocacy Day. This will be the first one in person since pre-COVID. So we are getting ready, and we are getting so excited about this, and we are very enthused that there's all these people who are registered to join. And we wanted to use tonight's presentation, which we are recording for those who can't join us, to tell you a little bit more about what to expect and to give you some updates about the legislative priorities that we'll be talking about, and also give you a chance to ask any questions so we can discuss some more. But thank you all for joining us tonight.
So hi, everyone. I'm Jennifer Donahue. I'm the communications manager for the chapter, and I support our legislative committee and do a lot of work on Advocacy Day. So I'm sure you've gotten emails from me and have been hearing probably more than you want to from me, but I am your go-to person if you have any questions about Advocacy Day. So I'm going to go over what to expect on Monday the 23rd. And talk a little bit about what the day will look like. And then we'll talk a little bit about effective advocacy. And then after that, we'll dive into our issues to give you sort of a primer on our top priorities for this session. So what to expect January 23rd. We get rolling bright and early. If you could arrive by 7:30, that would be great. We will have a light breakfast available, probably fruit, croissants or bagels, coffee, tea, water. But if you want anything more substantial, probably best to get that before you come. We're going to get started right at 8 a.m. sharp. Crystal will welcome us and give us any housekeeping updates we need. And then we've got a great speaker, Joe Leroy from Hope Sparks in Tacoma. He's going to be kicking us off first thing in the morning. So we're super excited about that. Grateful to him for joining us. We've invited a number of speakers and we're still in the process of confirming them. So Dr. Umair Shah, the Secretary of Health, will be speaking to us. And we've invited a number of legislators as well. And the ones in bold are the ones that we've confirmed already. The ones not in bold are the ones who we are still trying to find times for. So we'll have some great representation from the healthcare committees and among the leadership in both chambers. So here's sort of an outline of our morning, what it should look like. After Joe speaks, we'll dive into our top priorities and effective advocacy, and it will be kind of a repeat of what we're going over tonight. Never hurts to hear things twice. And also for people who are not able to be with us tonight in person, they'll be able to hear that in the morning. So bit of a refresher. Representative Tana Sen will be joining us at 9 o'clock in the morning, just to speak to us briefly. And she is always a great legislative champion for kids and always is working on bills that we support. Then we'll have a little time for practicing being an advocate. You can break off into small groups or just turn to the person next to you. This will also be a good time to ask questions or strategize a little bit with your district. Paul Harris, Representative Paul Harris, who's been a long time ally of ours in the House of Representatives, will be joining us as well. He has been always a champion of our efforts for vape prevention, Tobacco 21. He's just been a great ally. Then we'll get a little break, hopefully, before Dr. Shah joins us. And I urge you all to be sure to be in the room. It's taken us a little while to get him scheduled. So we're super grateful that he's making time for us and coming quickly from dropping his kids off at school to come join us. From 10:30 to 12, you'll be going in and out of the room to legislator meetings. We'll also have more legislators coming to speak to us during that time. And that is kind of the part that's still taking shape, who will be in the room when, but you can expect the bulk of your meetings to be during that time period. We'll have a break for lunch, which we will provide. We're going to have box lunches for you, so you can grab and go or eat in the room, in the Columbia room. And then Representative Lisa Callum will be speaking toward the end of our programmed time. After that, we're going to transition into member meetings. We need to have a bylaws vote. Those of you who are voting members have gotten emails from me about the bylaws proposed amendments. And we'll talk a little bit more about that in just a second. And then we'll have a board meeting after that, which you are welcome to stay for, or you may leave. It's totally up to you. So a little bit about the bylaws vote. This only applies to voting members of the chapter. We need to announce the outcome of the proposed amendments at 1:00 p.m. So we will be counting votes during the day, and then by 1:00 we should have an outcome to announce. If you are a voting member of the chapter and you have not yet submitted a proxy vote, which we have emailed to you, and we'll email it to you again. If you have not yet submitted it, you can email it to me anytime. You can print it out and put it in the mail, or we will put a ballot and a proxy form in your Advocacy Day folder. And we need you to fill that out, sign it, and drop it off to any one of us staff members on Advocacy Day by 11:30 a.m. So we have time to count. If you're a voting member who has already submitted a proxy vote, thank you. But we have to tell you that you may change your vote if you wish to. And if you do wish to, just grab one of us on the day of, and we can give you a new ballot, and we can get rid of your old ballot. So that's, a little extra bit of work that we have to do, but we'll be glad to have everybody in person so we can make sure we get that done. Just a little bit about your meetings with legislators. We're in the process of scheduling those meetings right now, and as soon as I have complete information to share with you, I will send it to you. Possibly tomorrow, probably not until next week. Your meetings will be about 15 minutes long. And so you'll just come and go from the Columbia room, from our meeting room. We'll let you know where to go. And you should plan to leave about 15 minutes prior to your scheduled meeting if it's in another building, so that you have enough time to find the right building and get through security. We understand that, and Amber, you may be able to speak to this a little bit more, but we understand they're asking for lists of constituents who are attending, and that legislative assistants will come down and walk you to the office, correct, from security?
It depends on which building. I mean, they have all stepped up security. In Sherburgh and O'Brien, they have on each floor, they have a security desk, and they have the legislator meeting schedules in front of them. So you just go and say, I'm the 130 for Senator Mullet, and then he can look down the list and see that, and then he'll let you into the hallway.
Great. So that is different than years past, and I just don't know how much time that's going to take, how many other people will be at the Capitol on that day, so until we kind of get there and assess it out, I think it's probably smart to err on the side of giving yourself a little extra time to get through there. And then please, as you're coming and going from the Columbia room, do so quietly. The shape of that room makes it pretty noisy. So even if just a few people are having a side conversation, the room gets pretty loud. And if we have speakers, we prefer to keep it as quiet as possible so that people can hear them. And we will provide a campus map, and so that you can easily find the legislators' offices. Collaborating with your district. I will send an email to you with all of your district's attendees who have registered, and contact information. I'll just send one email per district, so you can plan to connect with each other. If you wish to, you can set up carpools, talk about how you want to approach your meetings with legislators. You can do all that without me being in the middle of it. So I will provide that information to you tomorrow. So any questions about that section? Okay, I do have a question about the Columbia Room. So the Columbia Room is in the Legislative Building. That's the one with the Capitol Dome, this one. And it's on the lower level. So if you walk in this side door, that's real close to the Columbia Room. And we'll put a sign outside the room as well. Any other questions about the day? Oh, we're all initially meeting in the Columbia Room in the Legislative Building at 7:30 a.m. Yeah. And I emailed a campus map. I'll send that again, as well as a link to parking information, so that you'll have that, and you'll know sort of where to go when you get there. Any other questions about that? Does anybody have their hands up? Can't see. Okay, great. And of course, if you think of other questions, feel free to reach out to me anytime. So effective advocacy. This is from a bill signing a few years ago. You can tell because Sarah's hair is long. Amber.
Yeah, my hair is pretty long in that picture.
I know,
too.
like yours too. You're back here too. That's always a good sign of success, standing at a bill signing. So I will let you take over here.
Great. Thank you, Jennifer. And it's so wonderful to see so many familiar faces here and familiar names of, years past of in-person successful advocacy days. Just really excited that we're going to have one again. It feels a lot the same in Olympia. It's actually been almost kind of a giddy week being back at work after a few years of being away to meeting in person. It does feel a little different. A lot of people are wearing masks. Some legislator offices are requiring masks, as you may notice when you go in, and additional security to be, getting into legislators' offices. For example, this coming Tuesday, they're hearing many firearms bills, and we expect that it will be, again, back to the days of having some really challenging days on campus. But it feels good and right that we're there in person again. And also, be patient with those members and their legislative assistants that, there are freshmen, but there are also way more than freshmen, because there've been a few years of elected officials that have never been in person, and they're just trying to figure out how to do it too. So to the advocacy piece, so I always suggest doing a little bit of research on your members before you meet them. If you haven't met them before, the legislative website has bios, committee assignments on their member page, which you can find through the legislative website. I always think it's especially important to at least know what committees they're on, so you can kind of make connections with them based on the work that they're interested in. And then prepare what you want to say. I think that this is great to coordinate with other people you're going into the meeting. You'll definitely want to do an introduction and a strong orientation to the member that you're meeting with. I've already had a meeting this week where I was halfway through a 15-minute meeting and they asked me again, like, okay, now, what was it that you were talking about? Like, so they have back-to-back meetings. So like they might have one on forestry and then one on K-12 schools, and then you come in and, like me, you might just like think in your lane. And so just, that this is what I do. And of course we expect everybody to at least know what a pediatrician is, but still, anyway, if you feel like you're being too simple in the things that you're talking about, you are not. So anyway, just do like a 5-minute prep of the key things that you care about, why you care about them, an example, either from your own practice or that you know about that you would like to share that illustrates what you're interested in, and then tell them what your expectation is of them, why you're here today to tell the story, because you would like for them to X. And then also being ready to meet with staff. This happens to me too, happened to me twice today. Legislator gets called away to do something else, and you meet with their staff. Most legislative assistants are excellent at taking notes and asking good questions, so that they can give that information to their member.
Amber, we just have a quick question in the chat. Do the legislators get assigned to committees, or do they get to choose which ones they're on?
They get to fill out a form with their top choices, and then leadership matches people up the best they can with people's choices. So they usually at least get, 2 of 3 that they were really wanting. So just expect that you're going to have the warmest welcome. Legislators love pediatricians. Those of you who've done lobby day before know this. They want to know where you practice. They might say, oh, my neighbor's kids go, or my kids or whatever, go to your clinic. And we've even had research that has shown us in various states that when it comes to advocates, who are the most trusted people? Well, physicians, especially pediatricians, are very trusted advocates. So have confidence in your ability and of your rightful place to be here advocating for kids. Please do pause in the meeting. There's so much information, and I know you want to get through so much, but pauses to engage them to see if they're actually listening to you. Like, are you familiar with any of the behavioral health work we've done in the last couple of years? Or are you familiar with the work of the children and youth behavioral health work, or who knows, or something from your community? And then listen to their questions as well, and encourage them to ask you questions. And if there's by chance something that's just, more specific for legislative agenda or policy wise, you can always just refer that to me, and I'm happy to get back with them as well. But, giving pause, it's kind of a hard thing to remember, but important if you can. And then do I have another slide? We'll see. Yes, I do. So this kind of goes back to, I mentioned this already, but we're looking for support on our items. And what we would really love to have is not just support, but commitments. So if once you're running through a bill, for example, say, that we are advocating for universal free school lunches for all children. Do you plan to vote for this bill? We would really love to have your support. And, most of the time they'll tell you, sometimes they won't. They'll say, oh, I'm just going to have to take that under consideration, in which case you can say, great, I'll follow up with you once you've had a chance to think about it. So, thank them, remind them of any commitments that they have made during your time together, and offer to be a resource for them. A lot of issues relating to kids come before them every day, and say, I'm happy to be a resource. You can give me a call, send me a note. I'll be happy to help you out when I can. And then, yeah, if there's any further information that they need, if they want to see our collateral, one pagers, any of that, we can always get that to them later. You certainly don't need to have all that on hand or remember the things that they say. The key point really is for you to make a connection with your legislator and to begin or to strengthen a relationship with them. So, even more so, they'll look to you as a trusted advisor to their work on behalf of children's health.
I'll just add very quickly, we are sending our one pager with all of our issues to legislators' offices in advance. So they will have that information and you can remind them of that, or we can follow up and send it again if they request that. That's fine. Happy to do that.
Yeah, that's great. And that's a good reminder. Thank you, Jennifer. So some of the offices are organized enough that they will, the legislative assistant will have shared that, or at least put it in front of the member on their screen before they talk to you. Any questions about advocacy? I will also do something similar to what I just did the morning of Advocacy Day, including a little bit of role play to demonstrate the techniques that we're talking about, but I'm happy to answer any questions.
So we've got another question in the chat. Is it possible to request legislators that we've worked with before but haven't met? That's a great question. They will only take meetings with constituents. So if you live in that district, yes, you'll be, well, we're trying to set up meetings for you with all three of your legislators. We may not get all three of them, but that's what we're working on right now. So we will send those schedules out as soon as we have them. And is the one pager available for us now? Yes, it is. It's on our website under active issues. And maybe Alexis or Sophia can put a link to that in the chat. And I will also send it out with my follow-up emails to all of you.
And I can answer Molly's question that I don't think it has less impact. I mean, you are a voter in their district and you work in the community. So no doubt you see families from that district and well, and maybe even don't. I know some of you commute halfway across the state sometimes. But I wouldn't worry about that too much. Try to, still make some community connections with your legislator, but don't worry about it.
Okay, please feel free to continue putting questions in the chat, and I think we can move on to our issues, our top priorities. This is from the last Advocacy Day we had in person in 2020, right before all the things happened. And that is a great group of residents that came. So hopefully we'll see a few of those this year as well. Yes. All right, Crystal and Marcus, you're on.
Sure. And I thought Allie's question in the chat was a great lead-in because we'll go over our priorities right now, and we'll also go over them again on Advocacy Day. So it's nice to have some refreshers. And these are our top 3 priorities. So just to give you a little bit of insight into our whole process, it's always interesting to figure out how we determine our priorities. And last year was actually great because we got so many legislative wins on things that we could actually choose new priorities to advocate for. So we took a lot of information from our member survey in terms of needs that we are hearing from our members across the state in terms of things that were thought of as important. And these are the top 3 priorities that we came down to: free school meals for all and raise the age for juvenile justice, which I'll talk about. And then Marcus will talk a little bit more about behavioral health too. And the main reason why we try to pick 3 things, because there's so many important topics that are really relevant to child health, is when Amber was giving a lot of great insight into meeting with legislators, these are short meetings, and also legislators have a lot that they're navigating and on their plate. We want to help hone their attention in on these priority items, just because having 3 things or less usually helps, versus once you start getting into more and more and more, it actually diffuses the focus and makes it less likely that we'll get some progress to the advocacy that we're hoping for this. So we are very excited to talk about free school meals. This is a priority where we're aiming to get free school meals in public schools, including breakfast and lunch for all kids. Before, a lot of things are based on income eligibility and beyond. And I know during COVID, we actually had some options through this, but that was not something that was ongoing and longer lasting. And for me personally, my clinic serves 100% Medicaid patients. So I've been seeing a lot of food insecurity, especially with inflation and all the different costs. So I would have you think about different things that you've seen with the patients that you care for, whether it's in clinic or in a different setting, because those stories I think will really resonate and will be very effective for helping us with hopefully making progress with this. We have the bill numbers on our slides. It's HB 1238 in the House, and Representative Riccelli, who's actually our incoming chair for the healthcare committee, which is great, is one of our primary sponsors for it. And we also have our companion Senate bill 5339. And these are just some slides which show some of the things that we've probably been seeing through our own experiences and through our patients. But 1/3 of Washington households with children have had low or very low food security. And almost half of households have had reliance on food assistance in 2020 and 2021. And it's been interesting because in talking with my patients, I feel like a lot of parents are just getting squeezed in all directions economically. So when you're thinking about social determinants of health, maybe they're saving a lot of their funding for rent because rent has gone up dramatically and they don't want to get evicted. Or maybe it's being allocated towards other things that they're needing as costs go up all around. And food is something that's so essential. However, sometimes if there are access options for food security or food assistance, people will take advantage of it when they're getting squeezed in all directions. So I just think this is incredibly important. And we can go to our next slide. And this showcases some of the main reasons why having access to free school meals can improve health outcomes. There's a lot of information showing that this can, one, reduce food insecurity, two, reduce poor health, and also have impacts on obesity rates and BMI. Meals actually have a lot of nutritional components they have to meet in order to meet these criteria in terms of nutrient levels, as well as having like limitations on percentage of calories from fat and saturated fat. And there's been information shown that a lot of school meals can actually sometimes have healthier aspects than some things from school or from home. And you can use some of these points to help showcase the direct connection between this bill and the impact that it'll have on improving health for kids. Yep, and Jennifer put in the chat that NSLP stands for the National School Lunch Program. Just in case you're wondering what that acronym is. I know there's lots and lots of acronyms all over. So it's always great to never assume. I'm a big fan of making the implicit explicit and saying those things. And this also talks about how participating in school meal programs helps kids be better prepared for success. They miss fewer days of school. If they get breakfast at school, they tend to perform better on different standardized tests. And those who receive basic food benefits are less likely to have developmental delay than those other children who don't receive those benefits. And we think that by making this universal, this helps in so many ways. One, it decreases barriers to access. Right now, there's like lots of different administrative barriers, or if people have to submit a lot of information, they may not qualify, or if they don't get the information in. Two, it can help reduce stigma, where if everybody has access to things, it's great. And it just makes people more likely to get the food that they need. Yep. And this mentions that this resonates with me personally. When you're very hangry in clinic, I think it impacts your ability to focus. And when you think about children who can't access food or are skipping meals, this impacts their academic performance. And that impacts their ability to learn and then hopefully gain benefits from their educational opportunities. So this shows that hungry children have lower math and reading scores, may be more likely to repeat a grade. Sometimes this can lead to behavioral challenges, and sometimes they may miss more school, and they can have attention aspects and behavioral health aspects, and sometimes they may receive more special education services as well.
I just saw Amber put in the chat that there are companion bills that are identical in the Senate and House, and that the House bill will be the one that moves forward. Thank you, Amber. That's good intel. Do we have data to share for one of the biggest objections, which is food waste? That's a great question, and I don't have that on hand, but I will find it.
Yeah, I know that we have heard about that. We asked Claire Lane about that, and they do her coalition does have information about that, about
Okay.
how schools that have done this have been able to make reasonable estimates
Mhm.
of how much they need. But we can ask Claire.
Yeah, I think this is Molly. Hi, everybody. Posted that just as a chance to hear, be able to ward that off a little bit. I think I'm so excited that we're supporting a food insecurity, bill and measure, and testified on one like that last year for the chapter. And I just know that question comes up, all the time, and it's a legitimate one. And as we think
Yeah.
about, the impact on climate change and sustainability and practices that we can, help, if we are passing this, like helping address some of the bigger concerns, which, in most cases, food isn't composted around the state. And I know, hearing from teachers that work in those settings, how hard it is to watch so much food go into the trash, and know that increases methane and other things in our environment. So I think those are important things for us to also think about, as we think about children's health and kind of needs.
Yeah, absolutely. Any other questions before we move on to the next, to our juvenile justice, raise the age priority? And we'll move on.
Sure. And we're also very excited to have as one of our top priorities, raising the age, which is related to juvenile justice. And this is a topic and an issue that we've had fabulous groups of residents working on, and has actually been a focus of one of our equity webinars earlier in, I was going to say earlier in the year. However, I mean 2022, not 2023. And this would increase the minimum age of juvenile court jurisdiction from ages 8 to, I actually believe 13 to 14. And this will also allow the implementation of a study for relying on the upper limit of the juvenile court jurisdiction as the most appropriate. Yep, and I'm seeing Amber's comment in the chat too. One of the reasons why we actually have 13, but it recently switched to 14, is this just showcases how dynamic the legislative session is. We had it initially, and this is what it was going to January of like 2023 at the very beginning. We found earlier this week that the legislative sponsors are actually trying to change this to 14, which is why this is something that we're in high support of. But there's like these little tweaks that will keep on coming, and we're trying to get you the most up-to-date information all the time. And this bill is actually backed by the ACLU and the King County Public Defender's Office, and we'll get you more information off the bill number once it's out. And one of the reasons why this is something that we as pediatricians are focusing on is having our knowledge of brain science and development. Children can lack the brain development and skills to competently engage with the juvenile justice system at this point. And we don't want children to be penalized. Instead, we want them to have options to be able to be supported and help with different things. And I think talking about the frontal lobe, where impulse control, resistance to peer pressure, and decision-making are governed, is one of the things that doesn't form until later, I'd say in the 20s. I actually talked about this a lot with vape prevention and beyond when you're talking about tobacco 21, and I think it also applies here in many ways. And we think that this is a bill that is really focused on equity, because a lot of children from diverse backgrounds, especially BIPOC communities, are disproportionately impacted by this. And our national AAP has had statements recommending that legislation have a minimum age of at least 12 years for criminal responsibility. So this aligns with our national body as well in terms of guidelines. So rather than leading to like penalizing youth, causing harm, and which can actually increase the likelihood of future offenses, we want to really provide restorative opportunities and access to things. And this also shows too that younger children who are arrested and held in jail systems can sometimes experience bullying or have other experiences that really adversely impact their physical and mental health. Any questions about this? Yes, and Molly, I see your question about with all this data, I almost feel like we had wanted to be higher than 14. And that's a very accurate statement to point out, because just to give you a little background on like the recent history around this has been something that's been very dynamic. Initially going in prior to the season or the session, like over the past few months, there was actually discussion about trying to raise it even higher. However, we wanted to at least raise the floor. So it actually went down to like the lower floor versus having something in the high teens or early 20s for multiple reasons. I think from a feasibility standpoint, that'd be harder to push and get through at this point. And we want to make sure that the youngest children aren't getting left behind. Because I think with legislative session, it's sort of this mix where we have the things that we really care about, but we also want to try to get things that have a higher likelihood of getting pushed through. And I think with like the legislative sponsors, there's like lots of discussion that they had with the different partners and beyond about what make the most sense strategically, as well as for the principles that we're going off of for these things. And that's why we keep on updating our slides and our one pagers, because that's shifted around a lot. Jennifer, I could see your smile, because this is literally like everything is fresh off the press as of like Monday, and we're still getting more updates going to things. That's the dynamic nature of everything. Yes. And plus, especially when I heard that Washington State was like, had the lower age of 8, that just like made me so flabbergasted. The fact that that was at 8, we were looking at comparisons to other states around the country, and like many states, including with much more politically different systems, you know, like much more conservative states and beyond, which have much higher minimum ages. So this is something where we've been working on it, and we really want to help push this through. And we feel like by lending the voices of pediatricians across the state, we can help with making this something that can actually happen. And then we'll keep on pushing more for things later on too, but incremental change first, and then more to come.
Yeah, we'll be sure to get you updated information as soon as possible. But I was noticing that we're like one of 3 states with the lowest age right now, the youngest age. So that's just terrible.
And I did just want to give a shout out. I see Divya, who's on, who's one of our residents, and then Ellie Graham. They both gave like a wonderful equity webinar about this topic, and have also been incredibly involved, including other residents as well, in juvenile justice. So much gratitude for all of their hard work on this very important topic.
Okay, I guess that brings us into our final priority for the session, which is related to behavioral health. And, you know, I would say that, you know, for us in pediatrics, I feel like this sometimes feels like the legislative elephant in the room, which is just to say that, you know, behavioral health for so many of us feels like a primary concern affecting our patients. And, you know, obviously it is a crisis, and there are so many related needs that are affecting our community. And, you know, the complexity of that problem is really reflected in how these priorities have taken shape. But ultimately, you know, we are just aware that our healthcare system is not meeting the needs of our patients or our communities when it comes to mental health. So here are priorities laid out. We'll go through each one a little bit more in depth, but our legislative priorities, just to know, that are related to behavioral health align with the recommendations of the Children and Youth Behavioral Work Group. And so that group identified several priorities, and we've called out a subset of those priorities that are most closely tied to our work, to what we do, and where we feel like our collective voice can be the most influential. And so as we'll talk about, we'll go through kind of these priorities, as I mentioned, but they're kind of grouped into 3 different topics. The first is really focus on integration in primary care, so behavioral health integration in primary care. The second is behavioral health workforce. And the final is addressing the hospital crisis, which we'll talk about at the end. You know, just as with the other issues that we talked about today, and just like Amber was saying earlier, the goal is not that we are the policy experts related to the policy recommendations that we're advocating for, but rather that we're the experts on the medicine and on our patients. So as we talk about behavioral health, as we look at this data, because I know that all of us can do this fairly easily because these are all the patients that we see, consider which patients that you've seen that are represented by these numbers and represented by our policy requests. Because if a patient comes to mind and we can bring that patient to the fore with our legislators, we can really give that request a face and a story. And that actually is invaluable when we're talking about issues that affect so many patients. And this slide is pretty striking. I mean, as you can see, and as we know, I mean, we just have tremendous numbers of 8th through 12th graders that are struggling with depression, with anxiety. The majority of 12th graders will say that they cannot control their worrying at any given point. This is based on the Healthy Youth Survey from 2021. And really our numbers in Washington match national numbers. Similarly, the CDC would say that in 2021, 44% of high schoolers felt persistently sad or hopeless, at least at one point during the last year, which is just half of all of our teenagers. So just incredible numbers. These are also other numbers to have in mind as we talk through the crisis, but I mean, really astounding that between 8th grade and 12th grade, we have consistency in the percentage of students that have contemplated suicide, which is horrifying. And then also, the continued numbers of anxiety that are really just striking. And then also, as we will continue to come back to, and I think it is important to bring to our legislators, this is also an issue of equity. So all of these statistics are worse for our LGBT, BIPOC youth, and our youth with disabilities. And so as bad as they look, they're even worse for our vulnerable patients and families. So what we know about this crisis, and we can go to the next slide. So what we know about this and what we've heard from our members, the Washington chapter of the AAP, is that this is a huge part of what we do in primary care and throughout pediatrics. And that's reflected in the numbers of our visits and in our collective opinion. So, by some estimates, this is half of what we do in primary care. And when we poll our members, this is the primary challenge that we face for our patients and our families. And what's challenging about this crisis is that even when these children are identified and brought to care, the remainder of their evaluation and management is fraught with challenges. And the same challenges that affect our healthcare system throughout are just amplified by the crisis that exists in mental health. So inadequate workforce, impact of social determinants of health, and a referral system that is at the best of times convoluted and which there's rarely feedback for the primary care provider, which is so key when so many of these patients are being managed in primary care. So the fact that 78% of us don't get any follow-up is no, that's perfect. We can move on. Is just exemplary. Of just an example of how challenging this is. So what's great about this state and what's great about our legislative policies is that we have some incredible offerings related to integrated behavioral health in Washington state that have really started to address these issues in a real-time and actionable way. And so many of our legislative asks relate to expanding these services, and we'll spend a little bit of time talking about each one individually, but there's a focus on the FAST program, which stands for the First Approach Skills Training, and we can talk more about that for those of us who are not as familiar. We'll also talk about the referral service, the referral assist service, and then expanding PAL training for primary care providers, and then also expanding PAL expertise within the context of some clinics that will be working on developing integrated behavioral health. So some exciting things that we're asking for. The first specific legislative request is about that referral assist service. So for those of us who are not familiar with this service, it is incredible. And it's a service that connects parents and patients with an available therapist, and is based on their need, their insurance, their location. And also not only is it a service meant to connect families, but also meant to troubleshoot finding appropriate counseling offerings within the patient's community. This is a needed service. Obviously cannot amplify that enough, but we know that subjectively, but we also can see that objectively, that the demand has increased in the last year by 60%, so skyrocketed, which is a trend year over year. And so the ask for this legislative request is that we expand the service. So specifically, we're looking to increase the FTE to allow us to meet the demand of this referral assist service, to allow it to be accessible by more patients and families. The next specific request is on the FAST programming that I mentioned. So FAST programs are designed to provide real-time intervention that's evidence-based for youth and families. And it's great in that it's focused on really the most common issues that we see in clinic and the most common issues that our families are faced with. What's neat about it is that it's meant for primary care providers, it's meant for behavioral health providers, and it's meant for families. And it really gives us a way to meaningfully have an impact on our patients that are there in front of us. And not only is it something that we can take advantage of as primary care, but it is meant to be robust. It's meant to be offered in a wraparound setting so that we can have the same messaging between multiple different points of care for these patients and families. So the ask for this is similarly that we need to continue to expand upon this idea and upon the trainings that are offered for both primary care and mental health center-based therapists. And then finally, all the work that needs to go into ensuring the quality to continue to work on making sure that we're doing culturally sensitive work and that it continues to be meaningful and impactful for our families and for our state. And then I think we can go to the next slide. Okay, so this slide is specifically related to the partnership access line. So the PAL line, which I think a lot of us are pretty familiar with, obviously is another incredible resource that we can utilize in primary care to have immediate access to a pediatric psychiatrist to provide real-time consultation. This service has been incredibly successful, and we are looking to request expansion of this service, not only just to provide the service that they are doing now, but also, as a part of a prior legislative win, the Healthcare Authority right now is choosing 10 primary care clinics that are getting set up for integrated behavioral health. And the request is that as we set up this model and these clinics for integrated behavioral health, which we all agree is necessary in so many ways, that we allow funding for the PAL group to support these clinics with individual consultation, with case-based review, all of the things that are necessary to make sure that this is a successful program. So all of those that we mentioned before, when we think about behavioral health and the requests that we have, those are all kind of bundled within that, integrated within primary care. This next section is really focused on workforce, as we talked about. So really what we know is that a skilled workforce in behavioral health is foundational for all other recommendations. We really can't get kids into care if we don't have care to offer. And when they do get into care, we need to make sure that the people who are doing the work are experienced and capable and competent. And so the request that we have is to amplify the workforce deficit that we know that we already have, and also hopefully to improve this moving forward. So first of all, a core part of this is just increasing Medicaid reimbursement rates. That is a big ask, but is important. And also part of this is that it needs to be Medicaid rates in all outpatient settings, not just mental health clinics, but anybody that's doing behavioral health work for children needs to be compensated fairly and at a rate that encourages the kind of access to community to support that we need. And then the second part of this is really focused on reducing the educational debt burden for clinicians. So there's kind of a three-pronged strategy to do this, and it's involving conditional grants, focusing on diversifying behavioral health workforce in the next several years, and also creating a loan repayment fund specifically targeting individuals that are working in community behavioral health, but also to focus on retention. So when we get good folks, we need to keep them. So we have asks focused on making sure that the workforce that we have is strong and that we continue to strengthen it. And then the final kind of series of requests is focused on the hospital crisis that we are all aware of. Obviously we have families and we have children that are really just languishing in the emergency department, being referred there in kind of a last-ditch effort for care, and it's clogging up services in so many ways. And it's really just not offering effective management for these mental health concerns, especially in the setting of developmental delay. So our focus for our legislative priorities has been on upstream intervention. So we are interested in advocating for increased ABA support, for expanded DDA capacity, and then looking for wraparound services as well. This is something that Mike Barsotti has been working on, I know, quite a bit, and I know that he's on this call, and I wonder if, Mike, you have anything to add to our request to focus on the hospital crisis.
Sure, thanks. So the only part I want to add, you did a great job summarizing that, Marcus. That was great. The only thing I want to add is where this started from was a collaboration between Marybridge, Seattle Children's, and Sacred Heart Children's Hospital. And we came together to talk about how we might, as the 3 largest children's hospitals in the state, have a unified advocacy approach for behavioral health in the state. And what was really focused for this is acute care, right? There's the 3 hospitals talking. And really the amount of kids that were being boarded in the emergency rooms receiving little to no care was huge. And so this is a small part of our population, but eating up a huge amount of resources and being treated in the worst place possible. Think if you a developmentally delayed child or an autistic child and they're boarded in an emergency room. There's nothing about that sentence that makes sense, right, from a medical point of view. So the point that I want to say is this is the 3 children's hospitals coming together, starting with the clinical people, coming up with a plan of where we wanted to focus our combined advocacy. We then, after we sort of talked about the clinical side, expanded the group to get better perspective, then brought in all the legislative liaisons for each of the 3 systems. They went and found where the monies had already been given and where we were best to ask for monies. And then it was taken to at a state level to say all these other groups that are working on behavioral health for kids, how does this need layer in with all the other needs that are out there? And when that group finished, it became the #1 priority. So all that to say is that I know this is more on the acute side, but it really is dealing with a group of kids that are really they're just not being treated appropriately because there's no other choice. And a lot of the issues, the word abandonment gets used a lot. It's a bad word, but these kids get to the ER without truly having medical problems and then won't leave because the families just can't deal with it anymore. So having respite care, having DDA come out to the home and do stuff, just having the wraparound services will actually increase throughput for the emergency room and actually do something for these kids and their families. So it is something that all 3 children's hospitals have bought off on and signed off on. Thanks, Marcus.
Yeah, that's great, Mike. I really appreciate it. I mean, obviously, we all interact with these patients and families, and we might not be the ones necessarily in primary care who are seeing them in the emergency department, but we certainly see them afterward, and it never feels good to tell families that, have been in crisis and will be in crisis again, that we don't have good resources for them. So it's all part and parcel of the same conversation. Right. So I appreciate your input, but, we're all, just like you're saying, we're all working on the same issue, just from different angles.
And then your patients are seen more slowly in the ER, right? Because the throughput of the ER backs up. And therefore, your patients that are coming to the ER are getting slower service because there's less ability to see them.
And they don't get a bed.
Right.
This is Robin.
Right, Robin, that's incredible. What you're saying, that there's someone there for over a year. I mean, that's just it's not good care. It's wasteful service, and it just creates so many problems that are beyond even just that one patient in that one situation.
And just so you know, that is not unique to Marybridge's one patient. Seattle Children's can tell the same story. We can tell the same story in Spokane.
Right. Yeah. So, I think that it takes it's going to take a lot of us saying the same thing from so many different angles. And I think that we have, really a unique voice, and probably one of the more, if not most powerful voices in this conversation, which is why it's really a core part of our legislative priority for the year. But, as I mentioned, I really do think that this is also, quite tangible for so many of us. Like, we really see this every single day. And so it becomes easy to talk about and think about. And as Amber said, that's what legislators are looking for. They're looking for those stories and those patients to put some emotion and some story behind the requests that they're getting, so that when these, budget requests in this case come in front of them, they think about the patient that we, brought to their minds. So anyway, it's a summary of the behavioral health priority. We'll go over all of these again on Advocacy Day. Any questions about behavioral health specifically and the priorities that we are supporting?
Or any more questions about what to expect? How can we reasonably condense this discussion to 5 minutes, 5 for each issue? That is such a great question. Yeah, I think you're going to have to make some hard decisions about what you want to talk about. That is hard. I would welcome input from any of our experienced advocates on sort of how you are able to leave an impression on legislators when you have so much to cover.
I can say something if you want.
Yeah.
I'm Robin Rogers. I'm one of the hospitalists at Mary Bridge, and I'm the board rep for Mary Bridge, and I love Advocacy Day. It was my initial foray into the chapter, and I've never looked back, and it's sustained me more than almost anything else professionally. So I'm with you, Crystal. I cannot wait to be back in person. So in terms of how to limit things, if you feel like you're really struggling and you have so much more to say, that's a good thing. It means that you've hooked your legislators. And I feel like one of your primary goals of Advocacy Day is to build a relationship so that you can reach out to them and they can reach out to you. So form your 3 key messages, the 3 things you want to say no matter what, one of which should be, and here's why you should call me. And then the other thing I would say when choosing your 3 key messages is stories are more memorable than statistics. They can look at the numbers on the 1-page sheets that you will get. So you are armed with all of the data. As doctors, we often feel like if we aren't experts, content experts, we feel like we can't advocate. That you are a content expert. So don't worry about the numbers. They're on the paper. What you're there to do is to be memorable, tell a story, and make a connection. And you will absolutely wholeheartedly do that because this is what you do. And like Jennifer said, they love listening to us. So it's actually a lot more fun and a lot less stressful than if this is your first go round than you might think. Those are my thoughts.
Absolutely, 100%. That's so true. I read an article today that said people you talk to will remember just one thing about what you've said to them. So, think about one patient you can talk about that will illustrate what you're trying to get across, and just be yourself.
Yes, and I totally echo Robin at that. I think you summed that up really, really nicely. And I honestly think about the patients that you've cared for and the things that really get you going and the things that you want to see changed, because those are the things that we get really passionate about. And those are the things that we are speaking out about. These are the opportunities that we can get to help try to make things better for a patient. So I always call advocacy like productive complaining, because it's all the stuff that I'll keep on talking about in clinic to my colleagues. Oh, we really need something better for our kids. And this is an opportunity to say that. And I honestly think sometimes just connecting with legislators in that very real fashion usually tends to be the most effective because they care about this too, usually. Sometimes you have some legislators where you might have to build that connection a little bit more, but a lot of times you can find common ground. And I think some of these topics just resonate in so many different ways, like the rising costs of all these things and limited access to food, behavioral health, justice issues in so many different ways. So I think like build those connections and build those ties and think about the things that really get you going and connect with people. And I think that's the really fun part about Advocacy Day, connecting with colleagues and connecting with legislators and really helping speak out on behalf of kids.
Even
that's
if
what
you have what feels like a legislator that maybe politically or ideologically is not on the same page as you, like it's not difficult to find common ground because happy, healthy kid, good, sad, sick kid, bad. Like everyone can start there. And then you just work backwards. And often if somebody, a legislator is disagreeing with you, it's often from an ideological standpoint. And we are coming from a boots on the ground, like facts-based, evidence-based standpoint. So if it feels like you're not connecting, it might be because you're using two different languages. So if you bring it back to, sad, sick kid, bad, happy, healthy kid, good, sometimes you can at least get back. And if the only thing you guys do is agree that it's a problem, that in itself is a victory.
Thank you, Robin. So does anybody else have questions? I'll put the link to RSVP for dinner the night before in the chat again. We'd love to see you if you decide to come down on Sunday night. It'd be great to get together for dinner. Good chance to talk to each other, network a little bit, and catch up in person. That is at Mercado in downtown Olympia.
And I believe we invited some legislators to that Sunday night dinner too.
We did,
So
yeah.
that'll be a good opportunity too.
We'll see. There may be some surprise guest visitors. We'll see.
And I think dinner starts at 5:30, I believe. Correct me if I'm wrong, Jennifer.
You
So it'll be
know, I'm operating just on what's happening today and tomorrow right now. So
as we all
Alexis knows what time. I think 5:30 sounds right.
Yep, put that in my calendar. So I'll give people a good time to connect and discuss things.
I will include that in follow-up information. So everybody, you can look forward to hearing from me a couple more times before Advocacy Day. I'll be sending out updated issue briefs in our one-pager. I'll include the campus map again and links to driving directions. And then I'll send an email to you district by district so you know who else is attending from your district. And I'll send you your meeting schedules with legislators as soon as possible. Just know that we're working on that. Okay, if that's it, then we're done early.
Yeah. And also thank you all for joining. It's hard enough to join a meeting after hours, but especially at 7 o'clock. So thank you all for sticking with us and joining us for this, because we know that it's just, it's so exciting and emotional, but it's still time. And so we appreciate that you spent some of your time with us, and getting ready for Advocacy Day is exciting.
Yeah, so grateful to all of you. Okay.
Yes. Thank you, everyone. Get excited. We are looking forward to seeing you all in person.
All right.
Thanks, everyone.
Night.
Take care. Bye.